Hi everybody, I'm Shalia Hartvigsen. I'm the Physician Associate at Ward Institute. Today we're going to be talking about Profound. Profound is a non-surgical skin tightening procedure that uses kind of a hybrid of deep microneedling and radiofrequency. The results of Profound are about a third as effective as a facelift. Now, a facelift is actually removing tissue and tightening up the skin. With Profound, we're using natural substances found in our own body to cause skin tightening. This includes collagen. We about double the amount of collagen in the skin. It increases hyaluronic acid, and it also increases elastin in the skin by about 5 times the natural amount. So this kind of causes everything to get high and tight like it used to be. You lose all of those products as we age, and that's why we get that sagging. Another use for Profound, aside from just skin tightening, is actually removing fat. The way that this works is that the needles reach deep down into the adipose layer of the skin and kind of cook that fat. It takes a while for the body to metabolize that fat and send it away so that you notice actual results, but it does make a visible difference in fat deposits. The most popular areas for that are the submental area, meaning kind of the double chin area, as well as above the knees, and even cellulite on the thighs. So what should you expect during your procedure? We begin the procedure by numbing up the area that we're going to be treating completely. I do this with numbing injections, so it's a little bit uncomfortable at first as we're injecting the numbing, getting you all comfortable. But after that first few minutes, you shouldn't feel any pain at all. You may feel pressure or slight amounts of heat, but it shouldn't be painful at all. Then I use the Profound system to inject microneedles deep down into the dermal layer of the skin, and each of those pairs of needles acts as a bipolar radiofrequency, kind of heating up the skin from the inside out. This causes an inflammatory reaction, which your body responds to by producing all of those substances that we just talked about. Depending on the area that you're treating, I could use as many as 300 deployments in the area. This can take anywhere from 45 minutes to 2 hours, just again, depending on the area. During the procedure, there may be a very small amount of bleeding. This is totally normal. You'll also experience some swelling and even mild bruising during the procedure. Afterward, the swelling and bruising will likely increase a small amount, but not anything that some makeup won't cover up. After a couple of days, you should be totally fine to wear makeup again, go out in public, look super normal. You'll also begin to notice after a few days that you have kind of palpable lumps under the skin. These are usually something that you feel rather than see, and 100% of the time they go away within a few weeks to a few months, so nothing to worry about. So after a few days, maybe a week or so, depending on how quickly you heal as an individual, the swelling and bruising should be resolved, and then it'll look as if nothing ever happened to you. This is where the waiting begins. It takes at least 6 months to start seeing visible results of Profound. Over this entire period, so from the time you receive the procedure to even up to 12 or 18 months after the procedure, your body is responding by creating all of that collagen, hyaluronic acid, elastin, and producing those tightening effects. So don't expect an overnight result, but these are good, noticeable results if you're able to put the time into it. Some patients wonder, if they've had microneedling before and they didn't get the result they were looking for, why is this even something they would be interested in? Well, the difference between this and traditional microneedling is that Profound penetrates much deeper down into the skin. Traditional microneedling goes about somewhere around 1 millimeter into the skin surface, whereas Profound goes at least 2 millimeters, sometimes more. This allows us to penetrate deeper and cause more production of those tightening materials that we need. Another big difference is that Profound also incorporates bipolar radiofrequency. This increases the amount of inflammation dramatically, which gives you a much better result. There are some things that would preclude you from receiving a Profound treatment. There aren't very many, but those include things like allergies to lidocaine, if you have a pacemaker, or certain skin types. So again, that's something that I discuss with you on a one-on-one basis, and we figure out what would be the best option. If Profound isn't the right treatment for you, we'll discuss alternatives. There's something for everybody out there.